Hi everyone, welcome to the session. We just want to check that you're in the right session, you're here and you're expecting to be talking about using your patient experience, because that's what we're going to be talking about today. We know that following cancer diagnosis and treatment, it's quite common really to feel that you want to share your story in some way. Kind of, I don't know, for me it was about making a good use of it, kind of making use of that time that I spent in hospital. But also knowing how to do that can feel a bit baffling, like where to start, where is a good place, where's a safe place, and all those questions. There are tons of opportunities out there, and you might not always realise that because it can seem like they're a bit sparse on the ground. So that's what we're going to talk about today. I'm joined by George and Hannah. We're all members of Shine, who have subsequently done like work and volunteering or paid work around using our cancer stories, and where our experiences are central to the work that we've done. So the aim of today's session is to tell you a bit about our experiences of finding work in these kind of patient expert type roles, the challenges and benefits of doing this work, and where you can get started if you're interested. But before we start off, I'll just hand over really quickly for Hannah and George to introduce themselves and let you know a bit about them. So George, you go first.
Okay, so hello everyone. I'm George. I was diagnosed with acute lymphoblastic leukemia when I was 23, which feels like quite a long time ago now. But I had lots of intensive treatments, got clear, got past the 5-year survival milestone. I did then relapse and ended up having a stem cell transplant. But as you can see, I'm here and yeah, have got involved in quite a lot of opportunities to share my story and beyond since then. And I think it all kind of stemmed from the fact that I felt, I'd had a unique experience that could help others who might be going through something similar. And I thought, even if I could help one person, then it was going to be worth it. And I like to think that it's gone a bit beyond that one person I've helped, because I've sort of seized quite a lot of opportunities and got quite involved. But we'll talk all about that a little bit later.
Thank you, Jill. That's fantastic. And Hannah, over to you.
Hi, I'm Hannah. I was diagnosed with Hodgkin's lymphoma at the age of 33. I went through some intense chemotherapy, but unfortunately didn't respond too well to treatment. I quickly advanced onto a stem cell transplant, which involved quite a lot of time within hospital and an awful lot of time to reflect in terms of what was happening to me. That was a successful treatment for me, and I went back to work about 18 months later from my original diagnosis. But sadly, 18 months on, I relapsed, so I was back where I'd started from. I underwent some further treatment, and during that time, I decided that actually, in reality, I didn't want to sit at home. I'd met some wonderful people along the way and wanted to start trying to do some bits, but wasn't really kind of sure. So I volunteered to see whether I was actually fit for going back to work, and was really quite passionate about trying to help young people, because actually, whilst I'd gone through many support groups, I didn't see many faces probably under the age of 50, and at the time that was a bit frustrating. So really I've got involved with a number of charities just to try and give something back, or maybe help people understand what's happening to them perhaps before it happens. So I like to think hopefully I've helped the other person along the way.
Absolutely sure you have. Yeah, and me, I'm Claire, and I was diagnosed with a Ewing's osteosarcoma at 17, had treatment into my 20s. I also had a stem cell transplant. It looks like we're the STC triplets. Yes, and I initially got involved with the Teenage Cancer Trust, who had kind of provided me with treatment. I was treated on one of their wards, and I just immediately wanted to be like, what can I do to reach out to other people in the same boat? But over the years, it's progressed and diversified, and obviously I work with Shine now, but I do a lot of work in hospitals and training students and healthcare professionals, and that's the bit I've really found fascinating, is that kind of world of education and treatment. But so yeah, I mean, like I said before, really my drive to do that was to I felt like I'd wasted so much time being in hospital, and it was literally just almost quite selfishly like, how can I make this feel useful? How can I make this feel like it wasn't a big waste of time and it's actually valuable experience and expertise? So that was mine. That's great. It's so great to have you guys here. So first off, before we kick off about talking about the actual opportunities, we thought we'd have a quick chat about some of the kind of experiences of what it's like to kind of shift from being a patient who's dependent and in a bed and reliant on services to using that experience for something completely different, and it's kind of turning the tables, using it to reach out to other people in the same boat, or maybe to advocate for change in services, or all the things that we'll come to talk about. But I guess just reflecting a little bit, how did you guys find that shift from being a patient who was a diagnosis effectively to I'm someone with expertise and a story and something to say?
Yeah, I'd say that it was probably quite challenging, a little bit surprising at first, because yeah, as you say, you feel like you're a patient, and you have things done to you, and you're kind of in a position of a huge position of vulnerability, but that means that it can actually be quite empowering to realize that you can use your story and you can kind of turn that negative into what was potentially huge negative, obviously, into a positive, and do great things from that. And so I got a lot of strength from that. And I remember when I did first start getting involved, and I thought, oh wow, I know some stuff. People want to hear my story. So there's a definite kind of shift there, and it can be quite difficult at the beginning to recognize just how much value your story has, and it's enormous, and it's quite easy at first to think, oh wait, but there's a group of doctors, they must know more than I do, but they don't know more than you do about the actual experience of having cancer. So yeah, I think it can be a bit weird, a bit intimidating, a bit strange, but it can also be really empowering, can really make you recognize your own value as well, which I think is particularly important, because it's quite easy to lose some of your self-confidence and things when you have cancer and you're going through treatment and so on. I definitely found that, and I found that actually sharing my story, turning it into something positive, becoming an expert or a patient expert rather than just a patient, helped me build back some of that confidence.
Yeah, that's really interesting. I feel exactly the same, and I really relate to that kind of moving from a position of just having stuff done to you. That is how it feels for so much of the time, isn't it? That you're just passive in that relationship around your health, and it's really interesting to shift that, I think. I wonder, Hannah, I know you've spoken to kind of medics and doctors, and do you ever get intimidated by walking into a room of people who are these they are not so-called experts, they are experts in their field? How have you found that?
My background is training and development, so I'm probably kind of used to standing up in front of large groups of people and educating people in terms of a subject matter that perhaps the room isn't aware of. But actually, when you go into a room full of medical people, obviously they're aware of the medical element, and I never try to educate them in terms of the medical elements, but maybe educate in terms of the language or how that makes people feel. Because I think, you end up on a cancer journey, and I really hate that word, but you end up on this pathway. None of us really choose it, let's face it, but actually we get pushed into it, and then we get thrown out at the other end. And actually it's not until you come out the other end, or once you've been in there a little while, that you start to realize how this impacts you. But actually, in real terms, a lot of the medical people are very interested in getting you fixed, and they don't really worry about if you've gained a load of weight, or you've maybe got a bit of a sore back, or whatever the peripheral stuff is. So actually it's about talking to people openly and honestly, and I've always used humor, and I think, when you end up with cancer, that dark humour comes out probably for a few of us, so you kind of become the butt of a few jokes. And I remember having to do a presentation in front of my dad and my mum, and started having to talk about sex. I mean, who talks in front of their parents? So I sort of made it a bit of a joke, but actually the underlying message of what I was trying to say was real. And afterwards I'd use language, for example, when I relapsed, the team said to me, salvage chemo, and I was like, well, that feels like the end of the road. And I sort of cracked a joke along those lines within the presentation I was doing. But actually, 2 medics came up to me afterwards and was like, we'd never thought about salvage chemo and the impact that might have to the individual. Yeah. And actually, as a result, they don't call it that now. So in that particular hospital anyway. So for me, that was a success.
Yeah. And I think we can underestimate when we're talking about exactly like you were saying, George, like our stories, and how actually, because there are stories and they've just happened to us, they feel like, you know, it's not sort of some great insight or profound wisdom. You're like, actually, this is really unusual. And if you can kind of, you know, traditionally, that's how we spread words about things, is storytelling. And if you can use your story in a way that is kind of impactful, it's an expertise in itself doing that, isn't it?
Yeah, definitely. Yeah. And
yeah.
I think, yeah, the beginning, as I say, might not feel very confident about that, but yeah, it's kind of not something you have to dive straight into, and you're suddenly this enormous patient expert who everyone's turning to. But yeah, it's something that you might want to try or build up. I mean, if you're watching this session, then chances are you have some interest in sharing your story. So yeah, it's it can feel intimidating, but it doesn't have to be at all. And we're going to talk about a lot of the opportunities to get in that aren't maybe quite so heavy.
Yeah, absolutely. And I think that's one of the other things to think about before you start off on this kind of path of sharing your experience, is about that kind of how vulnerable it can be, because it is your story, and it can feel intimidating, but it can also feel very exposing, like if done in the wrong way, or done, you know, if you kind of, I remember I ended up sort of doing a newspaper story, an article, and I just thought, that's great, I'll share my story. And they rejigged it in a way that I was so unhappy with, and it felt really, and suddenly my story wasn't my story anymore. It was media speak, and it didn't really match what I'd said, and it was kind of, it was a bad experience. And I think it's worth thinking about before you set off on this, on any of these kind of opportunities, is just having a real reflect, not to say this should be a reason not to do it, but just to reflect about which bits of my story am I really comfortable putting out there and letting go of? Because I think you have to be willing for other people to take that and interpret it in their own way, and perhaps reproduce it in a way that you didn't really, you know, doesn't necessarily sit right with you. But have you guys found that kind of level of like the vulnerability and the boundaries with what you're happy to talk about? Have you noticed yourself doing that?
Yeah, I think there's an element of, it's your story to tell, and you only have to tell the bits you feel comfortable with. So there's part of your story that you're not comfortable in telling, then that's for you to hold back. You don't have to tell every bit. I think sometimes we think we need to say everything. But yeah, it does make you very vulnerable. But I think in my experience of telling my own story and also experiencing other people telling their stories, because of the very nature of the audience that you're generally telling it to, most people want you to kind of do good and do well with it. So actually there's an element of encouragement within the audience. So actually they'll gently encourage you to kind of tell your story. And I think, you know, some of the work I've done with Shine Through the Circles programs, where people tell their stories, they're all done in such different ways, but actually they're all received in such a lovely way. And actually it doesn't really matter how you communicate that, it's what works for you, whether that's pictures, words, images. It could be anything.
Yeah, I'd absolutely agree with that. That yeah, people, the kinds of places you could be sharing your stories. Yeah, people are interested, but also they care, and they you don't have to be word perfect and absolutely fluent or anything. People are going to encourage you. They're going to want you to do well. They want to hear your story and so on. So that's a huge help in that. But I think what Claire was saying about control is an interesting one as well. That certainly, yeah, if it comes to maybe media organizations or something, or places like that, then sometimes you can tell your story and then it's up to them how they're going to interpret it. So yeah, definitely thinking about it beforehand, thinking about what you are comfortable to share, and not kind of getting carried away and accidentally saying things you didn't want to say, and yeah, really kind of just making sure you're comfortable with what you're doing and how it might be used and things like that.
Absolutely, I completely agree. It's like, it's a great opportunity, isn't it, for, I remember getting all confident and completely oversharing and being like, oh, and you just kind of think it's just having a pause for thought before you go into these things, isn't it? It's there can be great value in telling people every single detail if you're happy to do it. You know, it's what you're comfortable with, isn't it?
I guess also there's nothing to say that you can't ask them what they're going to use it for and whether you can actually approve it before it's used in any context. So then you've still got the control over what they do with your story. If they don't want you to do that, then you can then make an informed decision as to whether you want to get involved with that.
That's a great point, absolutely. So we're going to move on and look at a few of the opportunities that are available out there, and we'll try and link back. I'll share my screen, and we just kind of made a list really of everything that we think is available, and I think it can be a bit difficult to know where to start if you're really keen to do this but you haven't got any contacts or links. So this is to reassure you that there's a lot out there in lots of different settings. So these slides can be made available afterwards if you want to keep them and have a look at them in a bit more of a slow pace in your own time. But we thought we'd start out with sharing your story, which is kind of what we were just talking about really, and where it began for all three of us, I guess, was just that desire to tell your story. And I know, George, you started off with a blog, didn't you?
Yeah. So I found, I suppose both times I was in hospital, I found it really helpful to write a blog, because I felt I could keep people updated, and if they wanted to read it, they could. I wasn't forcing it on people, and if they didn't want to, they didn't. But it was also quite cathartic in itself. But it was also my kind of, I suppose, my first experience of sharing my story and sharing a story that I started to realize a lot of people were interested in, and some of the kind of insights I was already starting to get while I was going through treatment, I could sort of share on my blog, and that's where I kind of recognized that, oh, you know, I could have an impact, a kind of positive impact by sharing my story. And it was actually through that I first got involved kind of more broadly, when Anthony Nolan got in touch with me, and they, for those who don't know, they run the register in the UK for stem cell transplant donors, and so we've all kind of, I think maybe all benefited from that, but they had been my blog in touch and said, oh, we really enjoyed this post, could we share it with your permission? And that's pretty much where it all started. So they'd read my blog, and obviously I could have said, no, you know, this is just for me if I didn't want to, but I was like, oh, I was excited. Yeah. I had a chance to ways I could, for example, help out with patient information booklets, so giving that patient experience to say, hang on, as a patient I wouldn't understand this. I went along to one of their, they were starting family days. This is when they were kind of starting out with focusing more on understanding how patients, or what patients need, and really getting that patient perspective. And yeah, it kind of ballooned from there, and that year they set up a new award at their sort of supporters awards for the I can't remember the exact wording of it now, it seems so long ago, but it was yeah, the sort of patient representative of the year, and I won it, and I was like, wow, this is amazing. Sharing my story has become useful, and they were recognizing it, and it's kind of not really stopped since then. Since then I've kind of got involved with different charities. I'm now an ambassador for Blood Cancer UK, which has given me all sorts of other opportunities.
Interesting, George. How did you find out about the did you have to apply for that, like a job to be an ambassador? What was the application process like?
No, well, again, I suppose, because I think in a way, for a lot of charities, it's still relatively new, or at least it was, sort of 7-8 years ago, when I was probably getting started in the sort of patient representative area, and doing a lot more of this, and certainly so with Anthony Nolan, they were just building that side of things, and then I became an ambassador for Blood Cancer UK when they were starting that process, and I'd got involved. So I'd been a bit more proactive in getting involved with them in that I saw that they were running an event, and I was quite interested to find out they were talking about some of the research they were funding. And so I went along to that, and I met someone, and afterwards I went up to one of the staff and said, oh, this is my story, you know, I'd love to share it more broadly. And they said, oh, well, actually, we've just been doing some videos, and we don't have anyone who's relapsed. So would you be interested in kind of sharing your story of relapse? And I was like, oh, yes, I will. And so from that, I got involved with the charity. And then when they started to build the ambassador program, they got in touch to ask whether I'd be interested. And I'm, Claire knows very well, I'm not very good at saying no as well, but also it was great because that was exactly what I wanted to be doing. I wanted to be sharing my story in case it could help anybody else. And through that, I've had some amazing opportunities. I got to speak on stage at the Royal Albert Hall for their Christmas gig. But it really ranges. You know, do stuff behind the scenes, focus groups, things like that, but also even just shaking a bucket or handing out flyers with blood cancer symptoms, things like that. There's so many opportunities once you get in, and you can be proactive, but if you want to start somewhere, then sharing your story is great. And there's a huge kind of network really of cancer bloggers, if you tag in some of the organizations you'd be interested in helping, I'm sure they would be kind of jumping to get you involved.
Yeah, absolutely. I mean, I'd second that. I'd say there's never been a charity that I've approached and said, do you want some help, that they've said no. Like, it's not kind of how they work. And so, I mean, I think you can feel a bit like, oh, I don't know if I'm asking the right person, but just say that, you know, approach anyone from the charity and say, what's your, you know, do you have a public relations person? If with smaller charities, it might just be, do you need people to tell their stories for you, run events, help events, those kind of things, and it can really work. Obviously, we will be talking a lot about how you can get involved with Shine as a charity in a minute, and we can talk about all the opportunities within that. And that's a great way to start because it's so easy, because you can literally just ask us, and we will say yes. So in terms of, that's a lot about charity work, but it doesn't have to be, does it, like talking in front of groups of people? Like I was thinking, just as you were saying, reading leaflets, I've been involved in some research, and there's a group at Imperial called the Voices, or the Personal Experience Research Centre, Patient Experience. Oh God, I should remember that. But it's PERC, PERC, at Imperial University, and they run. They have basically getting patients involved in medical research. So if you've got any experience of receiving treatment, they want your opinion on how research is planned, whether people are researching the right things, whether when it's published it's accessible for lay people, not scientists, to read it. And so there's all sorts of opportunities there where you're just sent information in the post and you read it and you just write back your responses. So it doesn't have to be this kind of like performative thing. If you're worried about public speaking, then there are many other opportunities as well. I was going to ask Hannah about her experience of talking in hospitals, because we've got both there, education in healthcare and PPI, are ways that you can really kind of get involved within the NHS, kind of, again, telling your story, but it's not through charities as such. It's more kind of about educating professionals.
I think for PPI, we probably need to say that's not the claims department. That is patient and public involvement.
Is it the drug that helps your stomach, the proton pump inhibitors, like it's not one of those.
Just in case people think we're being a bit confused.
It does stand for patient and public involvement, in case anyone is unclear.
My involvement came, I got to talking to my nurse specialist. I mean, I did spend quite a bit of time as an inpatient for my first treatment, and got to know my clinical nurse specialist quite well as a result of that. And she was looking at trying to set up a small support group, and she just said, would you come along, because we don't really have anybody that sits within your sort of diagnosis and your age profile, and I'm really keen to try and attract other people. So absolutely, I got involved. I got asked to do a small presentation initially on stem cell transplants, because nobody within that group really knew what they were. And from there, I then got asked to do some bigger presentations at a blood cancer event that they held within Manchester. And then off the back of that, again, got approached for other bits. I think I was proactive in terms of speaking to people within Macmillan centres to see whether there's anything I could do that would maybe help. And I think also it's just about asking the question really in terms of how can you get involved. So I also joined the local lymphoma support group. Again, I was quite passionate about trying to find other people of a similar age and sort of actually be a face there that if other people of a similar age got diagnosed, could also get involved. And I think it's fair to say that actually you don't have to be surrounded by people your own age. You can be surrounded by people of all ages. But when it comes to some of the challenges that are presented as a result of maybe a cancer diagnosis at this age in terms of finances or family commitments or work, then they are slightly different. But in terms of the experience and the impact that that diagnosis has, they are very similar. But I think it's just through talking to people really. I think, and I don't really sort of say no, a bit like George, I've probably got the same problem, but I think once you kind of get involved, actually there is a real kind of personal enjoyment from sort of seeing that what you're doing is actually helping or benefiting somebody else. But there's also an awareness in terms of who your audience is as well, because actually if you are delivering to healthcare professionals, you can probably be more direct, but actually if you're talking to patients about your experience, you need to be mindful of where they might be on their own journey as well. So it's actually having an understanding and some empathy to actually where other people are on their particular experience of cancer and actually how that might impact them. So, I mean, George and I both alluded to the fact that we've relapsed, and, you know, if somebody's at the beginning of the journey, it'd be important to make sure that you mention that, but put that into the context so you don't frighten somebody unnecessarily. So I guess it's about having an emotional awareness to what we're doing as well. But
yeah, absolutely. And it's knowing where to pitch it, isn't it? And you get that over time. I found, like, obviously I've worked with Hannah in doing peer support through Shine. We've both network leaders and running sessions that way. And you do tell your story very differently than you would if you were talking to a room of professionals. And I think it's a kind of, you grow an awareness of how to tell your stories differently depending on the audience. And I found in that way, you start to feel like a professional patient, because you are like, hold on, I'm adapting my message. I'm changing the content of my talks. Like it can, if you want it to, feel like a job and a role that is more than just going in to tell your story. You know, you kind of, you learn about health systems and how they work, and you kind of, you build your stories around them to not to convince them of your points, but it can be for that purpose, but also just to make sure that what you're saying has the biggest impact, I think, is where we're getting at.
Yeah, and I use a lot of images through my presentations of me before, during and after. So I had pictures of me in their ball because I felt quite comfortable at that point to share that. And actually the talk I did for Lymphoma Action, they actually then said, can they use those pictures and parts of that story within some of their literature? And I felt quite comfortable with that. So they have done that. But actually, I guess by using personal elements like that, it helps bring it alive because it makes it real. And it helps people, it makes it relatable, I guess, ultimately, what you're trying to do.
That real, it's where you get into that kind of, I don't know what you call it, not the perfect storm, that's a bad thing, that golden space, whatever, of like the personal story, but with a bit of kind of an understanding about health systems, and the combination of the two can be really, really powerful, I think.
Yeah.
I mean,
and I think,
yeah, sorry, George.
I was just going to say, as Claire alluded to, that you develop a lot of skills yourself and kind of develop as a person. And I mean, I am in my day job, I kind of work in content, and storytelling is a huge thing. And so the opportunities I've had to tell my story really help with my day job, and I use that sometimes at work or in job interviews or whatever, to be able to say, well, actually, I've told my story quite a lot. I know how you can tell your story, kind of thing. So it's thinking about how you're actually gaining a lot yourself, as well as helping other people through these things.
Yeah, interesting. I was just going to move on to the talking about paid roles, because I think this is an important thing to talk about. Like we were saying, a lot of the stuff is voluntary, and it's quite hard to say no to that sometimes. And I'm sure it'll come up in one of our tips about how you manage that. But talking about role, you can look for roles in health organisations where they want people who have had experience of illness. I work with a team called Bridges Self-Management, and my job is basically going in and delivering training to healthcare professionals in hospitals about supporting patients in the best patient-centered way. And all our training is delivered with a professional and someone with lived experience of any illness, really. But obviously I draw on my cancer experience a lot in that. And that's paid, you know, and so you kind of like don't assume that everything is voluntary. And yeah, be a bit careful around what you're willing to do voluntarily if it's impacting on your ability to earn money.
Yeah, I would say I was excited when I kind of got the first opportunity where I was getting paid for it, and then realized, oh, I can actually get paid for this. It doesn't have to be a voluntary thing, because I had a couple of kind of weird experiences where I was in a group meeting for something, and the healthcare professionals said that they couldn't make it to the meeting because it was their day off. And I said, the only reason I can make it to the meeting is because it's my day off. And so it was that kind of disconnect. But for me, it was when I actually got involved, kind of touching on the PPI bit again, with a clinical reference group for NHS England. And that's basically a group of mostly clinicians, but also a couple of, they actually call it PPV, public and patient voice, just to complicate things. But the NHS is very good at making sure that they have enough patient voices on all these clinical reference groups, where discussions are all about what the kind of strategic decisions within the NHS and how could we be doing this particular section differently. So I'm on the blood and marrow transplantation clinical reference group, and this is definitely one of those experiences where it can feel a little bit intimidating because all the clinicians are top level doctors, consultants, and they're getting into really complicated stuff. But when I can chip in there and feel actually I feel you're not thinking about patients enough, or I'm using my own experience to be able to shape how the NHS is going, and they offer me a participation payment, so I don't feel I'm just giving up my time. I'm actually being, suitably compensated for it as well, and that actually, it's because it's all a bit of a journey really. That came from my involvement with Anthony Nolan, where I'd kind of got involved a bit more strategically in an expert steering group, and from that I met other people. Again, it's that network, it's who you meet and who you can know, who were involved with the CRG, and they said, oh, actually I'm leaving that role, maybe you'd be interested in joining. And that, as I say, has been incredibly rewarding, not on the money side necessarily, but that is nice, but incredibly rewarding because you feel you're really helping to shape how things are done for everyone involved in that sector. And there are loads of opportunities within the NHS. You don't have to make that journey that I did. You can go and have a look yourself on the NHS sites.
Absolutely. And it's really interesting, isn't it, that I know, like you say, from this point, having done nothing, you could easily go and look at those opportunities. But I think for all of us, really, it sounds like it started off small, and then it's about making connections, and you find actually there's a whole world of people doing this stuff out there that you didn't know. And obviously, just by coming to this session, you've met 3 of us, and so you've already got 3 contacts who you can hit up for support and information if you want.
I think it's really important to say though, Claire, actually peer support is probably one of the easiest ways in, because actually our networks, there's community groups that meet that are already established, and that might be for particular cancer, or that might be for Shine, or whoever that might be. But those groups are only successful by people attending them and people being able and feeling happy to talk. And my experience of going to any peer support group has always been a positive one. I think people think we sit there and are all a bit like, oh, feeling sorry. That's been so far removed from my experience. But actually that's really important, because if nobody goes and isn't happy to talk, then people don't get from those experiences why they go in the first place, do they?
Absolutely. And I mean, I don't know about you, but I mean, I remember when I was having my stem cell transplant and I was like, this is never going to end. I feel awful and I'm never going to feel well again. And just, there was a girl who came on the ward and she looked all right, she was kind of up and about, and I had a really brief, it was literally, she said, hi, how you doing? And I said, rubbish. She said, yeah, I get it, and left. And I asked who that was, and they said, oh, she's a patient, she'd had this same transplant 6 months ago. That experience, like 20 years later, I remember so vividly. So you don't need to be like shouting from the rooftops. It can be really small. These little conversations you have with people going through the same thing can be just as impactful as kind of doing a news article or something. that just turning up and telling your story is doing this stuff. It doesn't have to be formal. And so, yeah, really great point, Hannah. Shall we move on and have a look at what opportunities are in Shine? Now, let me make sure I've got the right slide. There we go. I think Hannah's going to tell you about ways. This is a really, Shine's here and we are always looking for people to get involved. So it's a great first step. Hannah's going to tell you about what those opportunities might look like.
So Shine Cancer Support, we've obviously already heard about it because you're here today, but we've got a number of ways in which you could get involved. So the obvious one might be we're always looking for network volunteers. We've obviously got a number of networks across the whole of the UK, but as you're aware, there's probably the odd area that's perhaps missing. So we're always looking for people that might be keen to set up a new network, or if you wanted to get involved and engaged with an active network, we're always looking for people to volunteer, and that might be from arranging events, or it might just be showing that you're going to be committed and help the network leader at an event in terms of engaging with the people that are there. So it can be as small or as large an involvement in terms of the network as you want to kind of get involved with. So that's the first opportunity. The second opportunity would be, we are, since the COVID pandemic, running a number of clubs online. So we've got Film Club, Book Club and Craft Club, for example. They're hugely successful and have been running now for probably over 12 months. But if you wanted to get involved with those particular online clubs, we're always looking for new volunteers that might want to bring some fresh energy or some new ideas to those. Or if you've got your own idea for your own online club, origami, or a particular craft that you want to do, jewellery making, whatever it might be, then get in touch and let's see whether we can get that set up. The third opportunity would be, we have a number of blogs that are available via our website, and they're definitely worth taking a look at if that's not something you've done previously. But we're always looking for new content, and if you are currently writing a blog or want to have a go at a blog, then again, get in touch, and we'd love to hear from you, and so would our community.
Yeah, just jump in on that one, because the great thing about the Shine blog is, if you haven't done it before and you're a bit like, I don't quite know what a blog is, or what that might look like, or how long it should be, or what I should and shouldn't say, we've got Caroline runs it, and she can really help you. Like, there's a lot of support about writing that blog and what it might look like. So if that's something you think, oh, I'd like my own blog, it's a great way to start by just doing a one-off for Shine, and it will go on the website and you can see how that process works, I think.
The other option is personal experiences. So we've talked quite a bit today about our own personal experiences, but we love to hear people's personal experiences, and that might be in words, it could be in images, it could be even a little video that you do of yourself. But if you're happy to share your story, get in touch with us and talk to us about how you'd like to do that, and then hopefully we can have that chat in terms of how that can be used across the community, whether that's saved on our website or used as part of our social media. You have the control as to how that's used. So we wouldn't do anything you didn't want us to do, but we're always looking for new stories, in particular on cancers that perhaps haven't been talked about previously. But if they have, please do get in touch as well. That's number 4. Number 5, sorry, excuse me. Instagram takeover. So we have our own Shine Instagram, and we're always looking for people that want to do an Instagram takeover. So I went, in the days when we were actually allowed to go out and talk to people, I think it's 2019, I did an award ceremony in Manchester, and I took Smash It Man with me, and we took a number of pictures of me kind of getting ready for the day, being at the award ceremony, what we won, and then kind of the overall experience for that. Other experiences through our Instagram might be somebody's day trip to hospital or sorting out their medication. So if you've got something you want to share that is or isn't cancer related, but you'd like to take over the Instagram, then get in touch and you can be our Insta for the day. Fundraising, hugely important for us. Without fundraising, the charity wouldn't be here. And you know, on the scale of big charities and small charities, we are right down there in terms of our earnings, but we use every penny in an effective way to support the community that we work with. But in order to sustain that, we always need people doing fundraising. So whether that's yourself, or whether you've got a family member or work colleagues or a business that kind of wants to sponsor Shine Cancer Support, we would always love to hear from you, whether that's a running event, a guitar lesson, singing concert, whatever it might want to be. If you've got an idea to get involved in any idea of fundraising, we'd love to hear from you. Or if you'd like to get involved with the 30,000 challenge that we've got running, that we consistently keep running because of the 30,000 young adults that have been diagnosed with cancer in the last year, then again, have a look for some inspiration and see what you can do. It doesn't have to be a big amount of money, it could be a £5, or it could be £1,000. Whatever you can raise is always appreciated. And finally, but not least, is the healthcare professional workshop. So we deliver healthcare professional workshops based on the research that Shine has done, and we look at the key themes that have come from that. and we deliver that within a hospital setting, virtually at the moment, but historically we've done that face to face. And as part of those workshops where we educate the healthcare professionals in terms of the impact that the cancer has for our young community, we always ask for a patient story. So if you'd like to get involved and tell your story, then we'd love to hear from you, because we like to keep those fresh, we want to keep them current, and it's a great opportunity for you to test out your storytellings. So hopefully one of those 7 ways will get you involved. If you want to get involved in all 7 ways, brilliant. But if you want to just choose one and start to get involved with us in that way, we look forward to hearing from you.
Oh, thank you, Hannah, that was great. Yeah, if there are any of those that take your fancy, you can drop me a line at claire@shinecancersupport.org, and I can point you in the right direction for who to talk to about getting involved with those. I think we're out of time, guys, but it's been so lovely to have you on. Thank you so much for joining, and we will be with you in 1 minute in our live Q&A, and we will look forward to seeing you there. Thank you.